Hi, I'm Dr. Samhitha. I'm a board certified colorectal surgeon and proctologist currently practicing in Lux Hospitals, Gachibowli, Hyderabad. Fecal incontinence has several causes, the most common being some sphincter damage or excessive use of laxatives, irritable bowel syndrome, inflammatory bowel disease like some Crohn's disease, ulcerative colitis, etc., or even some central nervous tissue damage to the pelvic muscles, autonomic nervous system damage, even diseases like diabetes mellitus, multiple sclerosis, sometimes multiple vaginal deliveries. All these things can cause fecal incontinence to some extent. Fecal incontinence can be diagnosed by various methods. So initial workup includes whether the patient is having diabetes or any thyroid disorders, or basic colonoscopy is being done to evaluate for some inflammatory bowel diseases and to see if the patient is having diarrhea, any irritable bowel disease. Now, when after all of these the specific tests come into action, most importantly endoscopic ultrasound to rule out and to evaluate the status of the sphincters and their continence levels, anal manometry, MRI defecography, etc. So there are many tests to evaluate the causes of incontinence and why it is happening and the extent of the incontinence, and treatment depends on all these factors. Coming to the treatment of fecal incontinence, usually it includes again different parts, supportive measures like bulking agents or treatment of diabetes and thyroid disorders as we discussed earlier, and treatment of any irritable bowel disease, etc. Now, apart from that, coming to some specific measures, usually we go for biofeedback therapies that helps in most of the people. It is basically a nerve stimulation and cognitive therapy helping the patient to retain their continence to some extent. Apart from that, then comes the surgical management. In most of the patients, a simple sphincter repair is more than enough and usually sufficient to retain the continence. If the sphincter repair fails, which is very rare in very rare cases, then we go for surgeries like muzzle flaps, etc., which are a little bit more complicated and might further help with the patient's improved quality of life.